or screening, these types of things are really useless unless we begin to understand where people are coming from. And if we understand our history, in 1898, Native Hawaii, Philippines, Guam, Puerto Rico were annexed into the United States, often at great cost, where millions of people have been massacred. You know, and it is during that time, as I began to look at our history within my own family, I wondered why, if those students who are new here, and you catch the bus and you pass Alamo Park, there are a lot of homeless people there. There are a lot of old Filipino men who are single, never married. Why is that demographic trend skewed? And it is because many of them came homeless, childless, as orphans, because in 1898, the Americans decimated, over 1 million people died in Ilocos Norte, where my family comes from, the north. The infrastructure was ruined because of war, just as it is ruined today in Afghanistan and Iran. And so a lot of public health problems came about. And I also see the advances that we made in the bubonic plague, understanding malaria and the epidemiology of the disease came from the war, the Spanish-American War in the Philippines, just as the development of those Magnum guns were developed specifically for that war, so that when they shot Filipinos, you know, that they would drop dead instead of keep charging them with their poison darts and stuff like that. And so that's my story, my roots of how my family came here, and the young men who came to work in the fields. So language access to our history, and access to the stories of our family really have a lot to do with public health. And I like being integrated into ethnic studies, into American studies, Philippine studies, Hawaiian studies. And we should not have to have legislation. By the way, Hawaii is the only state in the country that has legislation that proclaims Filipino-American History Month. Why does it take legislation to be able to give teachers the permission to have No Child Left Behind curriculum set aside so we could learn our history and our language and relate it to why we should care about making America a better place to live instead of dropping out of school? So language access, these are farmers in Wailua. If you ever get a chance, go up early Saturday, Sunday morning, go to the old Wailua sugar plantation mill, and you can meet this Vietnamese family, Laotian families, Filipino families, and they're doing their 9-a-day promotion. You know, I like the trend of working together with business and economic development to empower people, because that is public health. Partnerships to improve academic performance and access to funding for higher education. This is at the Taste of Kalihi. We were trying to break the world's record to have the longest line dancing in Kalihi. We're in NAFA, we are trying to work with our young people that whatever we do, we always incorporate voter registration and voter education, so that we're not just recruiting people to go to school, we're not just getting people to have a mammogram, but we're wanting to help them frame their story of why, when they lose their job, they can't afford COBRA. We are working to build and family reunification. Many strategic plans of Department of Health doesn't include immigration, doesn't consider the factors of that. When congressional delegates, for example, when Ed Case was running for Congress, you know, his model of immigration reform was to extend the moratorium that prohibits immigrants who live in the United States. They cannot avail themselves of government services for 5 years, and he wanted to extend that to 7 years. And so it was very important for our communities to know that who you vote for is going to affect public health. And here, the caregiver industry has a lot to do with long-term care. And before we can talk to a woman about a mammogram or a man about colorectal cancer screening, we have to begin to take a look at their livelihood and put into dollars and cents what they are contributing and what is being taken away. And when students come out of this school, they better know how to frame the issue. And also, by the time someone is sick and goes to the emergency room, those issues are invisible, and we wonder why they don't come back for follow-up care. Maybe it's because they're trying to earn a living. Hamilton McCubbin from the School of Social Work collaborated with NAFA to try to write a grant for capacity building and training for the Filipino community. And in crunching demographic numbers in terms of Filipinos out-marrying, what we found was the Hapa Filipinos, the trend of the highest percentage of out-marriage is Filipinos and Hawaiians. And so it behooves us as a community to understand the Native Hawaiian issues as well. And many of our community groups are eager to learn about this, because not only are we neck and neck in health disparities with Native Hawaiians, but land reform issues and the right to sovereignty is something that is very complex and we need to understand. Moving along, again, a woman cannot get a mammogram if she is concerned about domestic violence. And in terms of health disparities, 7 out of 10 women between the years of 1999 and 2001 have been Filipino women who were murdered due to domestic violence. And even recently, we begin to see that families, intergeneration, are becoming succumbing to the statistics of domestic violence. And so we spend a lot of time before we even talk about mammograms and cervical cancer and Pap tests and the A's, B's, and C's about it. We need to begin to understand why is this woman not coming up? Because HMSA did a barriers analysis study, and what they found that Filipino women have the highest percentage of loss to follow-up for cervical cancer screening and mammograms. And so NCARD, through research, education, training, and advocacy and policy development, is trying to work with our communities to find out that story. Here's a slide with union workers from Pacific Beach Hotel. And they lost their jobs because of many, many labor relations issues. And it's about civil rights, it's about health disparities, it's about failed policies that are driving these people. And because I have had a chance to go and walk with them and work with community groups to do cultural competency training and get the stories of these workers who are always, holding signs, and we cannot get